If you're a nurse or healthcare professional striving for growth, balance, and career success, you'll love The Nurse Keith Show. Hosted by nurse and career coach Keith Carlson, this podcast delivers invaluable advice to help 21st century nurses thrive. On The Nurse Keith Show, Keith explores career management, self-care, social justice, and even entrepreneurship. Through inspiring interviews and expert insights, he'll help you create a satisfying career and life. Listen and follow The Nurse Keith Show on your favorite podcast app, and you can find all the links that you need at healthpodcastnetwork.com/nursekeith. That's healthpodcastnetwork.com/nursekeith.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Welcome to this special two-part series on female genital mutilation / cutting. We're discussing a topic that affects over 230,000 women and girls, or roughly the entire population of Seattle. That's where I live, right here in Washington State. The Seattle-Tacoma-Bellevue area ranks 5th among U.S. cities for populations at risk of female genital mutilation. This isn't something that's happening somewhere else to someone else. It's happening in our communities, affecting our neighbors and our patients. So let me share a personal story that transformed how I approach trauma-informed care. During one of my routine prenatal visits, I noticed signs of type 3 FGM during an exam. If you don't know the types, it's okay. I'll talk about it in a second. But when I noticed this, my heart started racing. Not from medical complexity, because there is some aspect of that. Of how do we properly manage this medically so there's a safe pregnancy and delivery? But from the human one, how do you begin this conversation? What words do you choose? When should I start talking about this? That moment crystallized something for me. Trauma-informed care, which so many people have heard about now, sometimes feels so abstract when we talk about it. But what it does require is deep understanding of specific topics that people have experienced trauma in. So when a moment like what I just described happens, I'm ready to approach it with intention and care. Because I've done my work and I've started to understand and become truly informed about experiences that have caused significant trauma with enough detail to handle these situations thoughtfully. So that's what I want to do with FGM. First, let's go over what we mean by FGM. Female genital mutilation / cutting. There's different terminology for this. We'll get into the podcast episode about this a little bit. But it's defined as all procedures that involve partial or total removal of the external female-assigned genitalia or other injuries to the female-assigned genital organs for non-medical reasons. This practice exists in 30 countries across Western, Eastern, and Northeastern Africa, parts of the Middle East and Asia, and within some immigrant communities in Europe, North America, and Australia. All that to say, it touches a lot of people in a lot of places, because sometimes in this conversation, we can narrowly think of specific African countries. Because to put this in perspective, some statistics show that Egypt has the highest total number of people who have undergone FGM, 27 million or so. And Somalia has the highest percentage with 98% prevalence with some statistics. But as I said, it happens all over the world. A brief summary of the types of FGM. There are 4 different types. Type 1 is removing part or all of the clitoris. Type 2 is removing part or all of the clitoris and the inner labia. Type 3, called infibulation, is narrowing the vaginal opening by creating a seal, formed by cutting and repositioning the labia. And type 4 encaptures everything that hasn't been captured in these 3 types. Rather than going into detail about these medical terms, which I'll put links in to understand more, let me explain what this means for real women. Chronic pain, difficulties during childbirth, recurring infections, and often deep psychological trauma. And yet, amid these challenges, we also see incredible resilience and strength. The landscape is changing, both legally and culturally, Well, FGM has been a federal crime since 1996, with penalties increased in 2020. Washington State took a groundbreaking step forward in 2023 for this state, where it passed a new law that had aspects of accountability and support systems for survivors, thanks to the work by the advocates in the Washington Coalition to End FGMC. What makes today's episode special, though, is that you'll hear directly from Isatou Jallow, a human rights advocate whose work spans disability rights and FGM awareness, and who herself is a FGM survivor. Isatou's perspective brings multiple lenses to this conversation, as a survivor, as an advocate, and as someone who understands the complexities of navigating healthcare systems while living with a disability. In the second episode of this series, we'll explore an organization making real progress in ending this practice globally. So, while today's story might feel heavy, and this whole topic is, there is hope and progress happening worldwide. As we begin Isatou's story, for those who might need support while listening, you can find resources and contact information for support services in our show notes. I'm also joined today by my colleague and friend, Dr. Joanna Stevens, a clinician and a member of the Washington Coalition to End FGMC. She has extensive experience caring for women affected by FGM. Here's Isatou. Isatou, we would love to just hear about you. Tell us about yourself and your journey.
So I am Isatou Jallow. I am from the Gambia, West Africa. And I am a survivor of female genital mutilation or cutting. So I am from the tribe called the Fulani that practices FGM. It's about 90% Muslims. And about 70-something% of Gambian women have gone through FGM. At the age of 8, in the summer of 1994, I went through it by surprise because I didn't know that was going to happen. It was a scary experience. It's been over 30 years and I can still remember like the pain, the impact, and all the scenario. I decided to leave Gambia to seek asylum in 2012. When I came to the US a few years later, my leg had gotten so big. And I was in pain and exhausted. I started going to the hospital. And after several tests, they advised me that if I want to be able to walk again, I needed to have my leg amputated. So through my hospital visits, that's when they found out that I went through type 3 FGM. I never knew it was type 3 FGM because I thought it was supposed to look that way because I'm not married or anything. But when I was told that it's type 3, I was really shocked and worried because I know I have had horror stories about the type 3. Like if I were in Gambia and I got married, I'll have to go through pain because they'll take a blade and just tear me open and take me to my husband. So here I had the opportunity to go through defibrillation, which they did on the same day that my leg was amputated, about an hour before. So after that, I had another surgery, the clitoral restoration surgery. I started going through counseling and I did pelvic floor therapy. All of that together with the counseling has really helped me like start viewing my body in a different way. But I have always felt incomplete. And prior to having all of these resources, I didn't know that's what I needed or it was even possible to view myself in a different light. Since I went through FGM too, I have always been curious, tried to read books around it since I was a teenager. And I have been advocating against the practice for a long time to see an end to it or a reduction of the practice.
Thank you so much for sharing all of that. It sounds like it must have been incredibly difficult and traumatic to go through all of that. And then, of course, to be re-traumatized by this discovery later on. I can only imagine what that journey has been like for you. Was there any moment during your journey through the health system here in the United States where you felt that anyone treated you in a different way?
Yes, in the US, I've been fortunate to have a doctor who was very empathetic about my situation. Like I've always been insecure around FGM because in Gambia, not everybody goes through it. There are tribes that don't go through it. And my mom is from a tribe that doesn't practice it, but the family is mixed. So I went through it. But the stigma is both ways. If I didn't go through FGM and I hung out with people who practice it, they'll be calling me Sulima, which means unclean, you're not pure, you have bad luck, things like that. They'll judge you saying that you're promiscuous because you have not been caught. If I was around people who didn't practice it and the stigma was, oh, you're not going to enjoy a man later in life, you are looked down upon. And when I came here, it was the first time to have someone examine me. And it wasn't the most comfortable thing, but my doctor was very nice. She made me feel very comfortable. The first few times, my body would just contract. I was diagnosed with vaginismus because I'm still traumatized and I'm insecure. Having someone look at me or touch me down there wasn't comfortable. It took time and me being convinced that it's a safe environment.
Thanks, Isatou. I'm wondering about just the terminology itself, because I've heard different things. Some people call it female genital mutilation. Some say female genital cutting to not disparage the culture where it's happening or people who are doing it. And then actually, if you talk to a lot of people who have had it, they don't use either of those terminologies. They just say circumcision because we do it for males and it's similar for females. What terminology should we be using?
So most people, even in my country, we call it FGM. Then there'll be lawmakers, especially this year, who were trying to overturn the law against FGM, who will be like, it's just circumcision. In my view, having gone through all of this and seeing the effects of it, I just say mutilation because I believe there is nothing to really cut there and make it seem nice. I just say mutilation. But I understand that because there are people who went through FGM, they are still sensitive around the subject. So if you say female genital mutilation or cutting or use certain languages, they might not be open to discussing the thing further because they'll think that you're criticizing and maybe they may not feel safe to open up. Or I think follow their lead on how they describe it or call it and go with that.
That makes sense to me, meeting people where they're at. Joanna, you care for a lot of patients with FGM. How did you bring it up?
I would say the context for me in terms of when it's in a clinic setting is really often in our prenatal intake. And that's often where I identify a patient who has had it. In my standard kind of questions, rather than using this terminology, I ask a question along the lines of, has anyone ever altered your private parts or done any kind of procedure or surgery to change them when you were younger? Or was there ever any change made for cultural reasons to your genital area or private area? But I certainly have had patients who didn't tell me, and then we discovered it when they came for delivery, essentially, of their baby. And so it is such a private issue. And as Isatou pointed out, many women may not even realize it was done to them when they were a small child. They may not remember it if they were very young.
Yeah, what Joanna just mentioned is important, asking open-ended questions and seeing where they take it. And also keeping in mind that there are many women, especially talking about sex, reproductive health, or anything around the female genital is considered taboo. So it's not like something that we'll sit down and talk about openly. So if you come to a country like the US and you start getting questions like that, it is a culture shock. So I'm cognizant of the fact that I may be more open to talking about my journey, but there are women who may not be.
Something I've seen and can imagine is patients who have experienced FGM see the feelings of possible anger, sadness, possibly even betrayal, but also still love for family members who made them undergo the practice.
I'm glad that you brought that up, because I remember someone asked me if I am angry at my grandparents for letting this happen. But I'm not angry at them, but I wished it didn't happen to me. I have experienced that anger because before I knew that you could have any surgeries, knowing that this is a permanent thing that is done to you, you're never gonna feel like a normal woman would feel in certain circumstances. I have had the sense of betrayal that I wasn't protected. Like, why do they need to do this to me? I have a disability and my right leg has always been painful. It was deformed. And when I went through FGM, there were people pressing that limb down. So it was that pain and then being cut. That is so unfair. And it took me a while. I can't reconcile how the same society that will marginalize me as a person with a disability, who is not even good enough to get married, yet still you're cutting that child's clitoris, because if you don't cut it, she's going to be promiscuous. So it doesn't make sense. How do you reconcile a marginalized person who nobody wants? Why did you need to do it for me? So it was a lot of confusion that I didn't have anybody to really discuss it with, because also it's a culture. Whatever happens to you, you have to just be patient, persevere, especially if it is something like FGM. Those who practice it in my country will say, oh, it's Islam. So there will be no regret around it. And I also know of other people close to me who would express how they feel, how angry they are, that they wish that it never happened. But I don't think the anger reaches to a point where you hate the people who did it to you. For me, I wish it didn't happen. Eventually, I just chalk it up to they didn't know any better.
Thank you, Isatou. We talk about this from a medical standpoint a lot, but you brought up such an important part about the psychological and the psychosocial aspects of it. Because an entire community of women and countries go through this, in the United States, I know you talked about therapy. I find that therapy is not accessible for so many people. I know it's helpful, and it can be with the right therapist and the right modality can be really helpful. Have you seen anything that's been effective or productive in talking about this at a community level to help people process what they've been through and heal as a community?
I have participated in some, but I don't know if this is an ongoing thing where women circles, organizations will invite women and we'll sit in circles and share our experiences. It's a safe environment where we do it. But I am also part of the Washington Coalition Against Female Genital Mutilation that advocated for the new FGM law here in Washington. And we are still doing meetings around how best to approach it at the community level. We're creating safe environments where women can share their stories, share resources, talk about it, like remove the stigma around it, to have more I believe learning more about FGM and its effects, the psychological, the social and the medical harms around it may help people open up more and seek help, because the whole goal of the Washington Coalition Against Female Genital Mutilation, trying to get in local organizations involved. Some of these organizations were founded by immigrant women who themselves went through FGM. And if I go through it and I approach someone from my country in a very respectful way, have conversation around it, maybe they'll open up more and feel more comfortable and not see those who did not go through it as their enemies. Because earlier I mentioned that the stigma comes from both sides. Those who went through it would be very defensive, seeing it as though those who didn't go through it are attacking them.
Thanks, Isatou, again. I've had patients who don't fully share with me, but their intent is to take their daughter back to their country of origin to continue female genital mutilation. Is there any way to bring this up for mothers who are feeling like they have to take their daughter back to their country to continue the FGM?
Yeah, like that too is an issue, like holiday cutting, where they take their daughters back home. FGM is deeply rooted, and some people, when they really believe in it, there is nothing you can do or say to sway this. We talked a lot about this on the coalition, and we discussed these things, and hence the legislation, so that there will be repercussions where the doctors, the social workers, people in the society too will be mindful of these things and report it when it's happened or when it is suspected, because it happens a lot.
Yeah, I think as Isatou was mentioning, the new law that passed in 2023 in Washington State, fantastic work from the coalition that she's part of, and it delineates the kind of the criminal legal consequences of forming these practices. It also has resources for education and outreach to communities affected. One of the big concerns when these become more legally delineated is, will people, once they know of potential legal consequences, be less likely to bring their children to the doctor? Will it cause people to hide from health institutions because they know of the potential for criminal processes?
Legislation usually drives the practice on the ground. It doesn't stop it. People hide, like we've seen it in some African countries that enacted laws against it. People would still practice it, but then it becomes more harmful because it's been driven underground. So I think reaching out to communities, it won't just be women. It will be inviting the men, because FGM is a patriarch. It's around women being promiscuous, or you have to be a virgin when you get married. They have to sew you up. Like in some cultures where FGM, it's even worse than type 3, where cutting out your wife on the night of the wedding and showing the knife, the bloody knife, is celebrated. I think here in the US, it's educating people and involving the men, involving the religious and traditional leaders here. For example, there is a Gambian mosque here, there are Somali mosques here, and other communities too that practice it. So involving the religious leaders, the men, and the older women, the women who are affected, and having a dialogue with people, because even if the women know, the reality is they don't have the last say. It's usually the elders, the men, and we don't want it to be like that, but that's the reality.
Yes, definitely. And a place of hope in some ways. I was looking at the World Health Organization data of different countries who previously had FGM as the norm and have changed substantially. So, for example, Ethiopia, Sierra Leone, Liberia, Kenya, compared to 30 years ago, they've dropped significantly. Yeah. So what does it look like to keep making progress, which is important to hold on to that hope of something that feels so hard to change because it's a community belief system.
Yeah, people who justify it with religion too. For example, in my country, when they attempted to overturn it, there was a big fight between imams, those who swear that it is sunnah, the prophet recommended it, and then those who are like, no, there is no evidence that Prophet Muhammad's daughters went through this, that he recommended it. It's harmful. I think it's just culture that is deeply rooted. And like I mentioned, it's a lot of education, dialogue around it, and not giving up. but there are people who are very stubborn in what they believe and keep doing it. But the good news is I am very hopeful about this generation because I've seen the rise of organizations of young people who are curious and have done their research and they're fighting. And some of these women are the ones who joined the coalition.
That's great. We all need to hold on to that. How do you communicate about FGM with the interpreter in the room? Because interpreters bring their own belief and sometimes resist it. Either discourage the patient from sharing it even when they want to, or tell them just don't interpret it completely.
Yeah, you are right. The interpreter may come with their own bias, especially if they come from these cultures and believe in FGM. But I think if, for example, you as a doctor having a conversation with a patient and maybe brief the interpreter to use sensitive language.
Yeah, it's a very difficult issue from everyone's perspective. And as a doctor, you're always worried when the interpreter is not interpreting everything you say or everything the patient's saying. And I think as doctors, we've all kind of been in the room when you ask a question, the patient answers in a 3-minute response, and then the interpreter says no. And a lot of things were said there that I didn't understand. Can you please interpret everything she said? Or and they'll just give you a 5-word answer. And so I think for me, it's a very difficult issue. The only thing that I think we can really do is just listen and watch body language carefully. And if the patient is giving an extended response, or there seems to be a lot of back and forth between the patient and the interpreter, and then you're getting small, limited responses, always feel empowered to step out of the room with the interpreter phone or the interpreter in person and say, it seems like the patient is saying a lot more than you're interpreting. Do you feel comfortable as an interpreter in this situation? Would you prefer that I call a different interpreter? Reading body language is so important. So if you're looking at the patient and the patient seems closed or withdrawn when speaking to the interpreter, or seems frustrated, fearful, or irritated while they're speaking, and I always worry that there may be some sort of pushback or interpretation issue or cultural issue. Maybe the interpreter's from an ethnic group, or maybe the interpreter is a male and this patient is female and this is an uncomfortable topic for them to interpret. So you can also separately step out of the room with the patient, get a different interpreter, say to the patient, would you prefer a female interpreter? Right? So I think one thing that we do a lot of in OB care is broaching this topic and broaching how it's going to affect delivery of the baby. I know a lot of patients come in with a lot of anxiety or concerns about what may happen in the delivery room. We want to make people feel as safe as possible and as comfortable as possible. Something I've run into before is I've had patients who are worried about the delivery, but they say, this is the way I am now. And when the baby comes out, if there is a big laceration, I want you to just repair everything back to the way it was, because that's who I am now and how I want to look now. And so it's an interesting space to inhabit, that you're repairing back to something that was done to that person, repairing it back to the way it was, even though that was not the kind of natural anatomic way they were born.
Anything else we missed, Isatou, that you feel like is important for people to know, or audience members who are healthcare professionals, physicians, doctors, on caring for people who have experienced female genital mutilation?
Yeah, I think we covered most of the things, being sensitive, being respectful and empathetic to the patients, and just using the right language, creating a safe environment, assuring that they are safe and whatever they share is confidential. That will make some very comfortable to open up more to their healthcare providers and asking open-ended questions and see where it will lead.
Thank you. That was really helpful. I know this was a tough topic to often talk about for many folks. Thank you for helping educate others and advocating for women all around the world.
Thank you so much.
As always, thank you for listening to Healthcare for Humans.
If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized, topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.